Welcome back to the Talking Hedge. I'm Josh Kincaid, and this is your Cannabis Business Podcast. Today, we're going to have an interview with Mike West of Embark. Mike has a lot of experience from extracting cannabis and hemp from different states, universities even. So I hope you get a lot out of this. Sit back, relax, kick up your feet, and enjoy.
It's complicated what you do, but it's simple at the end of the day, if that makes sense. And those are the best, I think, concepts.
Yeah, well, it's all technologies that, the products date back to ancient times. We're just able to take those ancient technologies and use the tools that have been developed over the last 100 years, last century, to be able to take, for example, hemp seed oil. The last time they were making hemp seed oil was in the early 1900s for lamp oil. But back then they didn't have technology to do cryogenic extraction or any type of extraction. It was all just squeezing the seeds and you get whatever comes out, which is a mixture of oil, water, and chlorophyll and other fats and waxes. Whereas now we can actually use a lot of the technology that was developed in the hemp or cannabis space and take that cannabis extraction, take it on a commercial scale, because now we can take it on investors, and build it at a much larger scale so we can take advantage of those efficiencies of scale, be able to produce products on the market. So what do we bring with us today? Well, Embark's actually in the process of building a couple facilities. One of the facilities we're building is in Kansas, of all places. Kansas just allowed industrial hemp. First it was industrial hemp research. So the first year that we were able to start processing actually was last April. They approved it. We applied for the license, got approved on the license, did some research down there, doing large-scale hemp seeds extraction. So these were previously hemp seeds that you could buy off the shelf at any grocer. We took them, extracted all the hemp seed oil out, and what you're left with is essentially the endocotyledon, the little leaves inside the seeds that are bleached white. We've removed all the oil that's in them. And it's got wonderful, great protein, great calories, 114 calories per gram. Protein, 21 grams of protein.
But it's also gluten-free, keto, paleo, vegan.
Technically no soy, so you don't have to worry about estrogen. It's nut-free. You don't have to worry about it being egg. It's 70% protein by weight. So this is something that you could easily eat, put on any salad, anything like that. Or if you were to grind it up, which we ground it up, you have a hemp seed flour. And this could be used as any sort of grain substitute. So now we have a gluten-free flour that you can bake with. Put it in anything that you want your pasta, except for you don't have to worry. It's plant-based. You don't have to worry about any of the glutens. And then,
so I'm gluten-free, dairy-free, and I don't really like gluten-free noodles. I'd rather do zucchini, and it's because it's still irritant. It's a gut irritant. I feel rice is irritable, even though it's not gluten-free. And so, do you think this is going to help with that?
Better than rice.
Better than rice. Yep. So it's not going to be inflammatory.
And that's just what I've been.
Your experience.
Yeah, we're going to have to take it through all the different product trials. But
I'll be your guinea pig.
We're looking as a replacement for any of the wheat proteins. It's fully water soluble. Grind it up, throw it in water. Or you can, essentially, what I like about it is you can replace it for all the carbohydrate bullshit that's in the market, right?
Right.
And that's something that I don't talk about a lot, but it's one of those things. If we can give, good substitutes, because I'm not going to force everybody to stop using carbohydrates, but if I can have them switch from, it used to be almond flour, right? But almonds aren't the most sustainable crop out there.
No, and nuts don't settle with people either, but to avoid being hangry, you want to reduce the amount of carbs, and this is one of those ways of doing that.
Yep.
And this is just one niche thing you do. This oil, is that one thing that you were processing with like a 6-foot diameter extraction machine?
Yeah.
Like you fit in there and you look small.
A
ton at a time, literally.
A ton per run.
So in addition to hemp seed oil and hemp seeds, you've been in the extraction industry since the days of old. Like you came out of your mom's womb extracting oil already.
No, well, I back when I was going to school, I was pre-med trying to study cannabis, and they didn't allow us to research cannabis at the university. So I got into biofuels production, which is vegetable oil processing, and that's processing lower value veggie oils, not so much the essential oils found in cannabis. But as I was in college, and as college progressed into the medical industry, we ended up switching into medical research because it was easier to do research in the private sector than it was in the public sector. So we got into doing research, did the research, create products, bring them to market, and once you bring them to market, then you can do some more research because you have a self-sustainable brand.
So I met you when you were at Green Lion
Lion in
Farms in Seattle over 5 years ago before you left for Chicago.
To build Cresco. So
And
that was a medical lab, and then we ended up getting a recreational lab. Brought in a couple investors, and then obviously what we've seen is a lot of the laws on the West Coast have moved at a faster rate than the laws in the Midwest and East Coast. So as we started to have rec laws on the West Coast and medical laws start passing in the Midwest and East Coast, there's a ton of companies out there that want to set up. Since we can't do any sort of international or interstate commerce, we have to go set up the farm there, grow it locally, develop that terroir, and start extracting from local farmers. So I ended up looking out, knowing a couple group out there that ended up being one of the larger licensed producers in Illinois with a couple of licenses. Helped build them their lab, and because I'm a Northwest boy, after their lab was operating in Rock and moved back to Eastern Washington because Northwest where the weed grows.
It's beautiful. We're here in Vancouver, BC for the International Cannabis Business Conference, and while Florida was blowing up hotels with butane hash oil, you were already setting up professional facilities across the country. You are now here. You moved to Vancouver, BC,
Yep.
And so you're out of the Petri dish experiment called Washington State. And so briefly tell me about why you would pick Vancouver, aside from the obvious.
Yeah, so the biggest reason, obviously, Canada passed a federal law. That federal law came in over a couple series of laws. The first law that went into effect last October 2018 was the laws for flower. This October 15th, they actually legalized cannabis extracts and manufactured products. It's a federal license. You still have to get licensed on a local level, but it allows for us to produce products not only here in BC, but to be able to distribute those products through government distribution websites, etc., to mail them to any customer in the country. So it allows for us to be able to produce recreational, medical grade, and potentially pharmaceutical grade products and get them federally regulated. And what's nice, even though that's a lot more paperwork, it allows for us to do research at local universities. We can actually fund those product trials to make medical claims after we do the research. And it allows for us to develop products that we can not only distribute here in Canada, but we can export to any other country that has laws that allow importation. So we're working on with our group, Embark, is going to be working with a couple of groups over in Europe, in Africa, in Australia, around the world, because ultimately we don't want to extract everybody's cannabis, but we want to be able to help set up extraction labs in each region that's producing cannabis, because the strains that we produce, for example, in Central America, the Caribbean, are going to be different than the strains that we can produce here in the Northwest. So we want to be able to maximize the quality that we're producing out of those different markets. So it's been absolutely fascinating. Obviously, it's Vancouver, great place to visit. It's a very accepting culture. So being able, here in Vancouver, you're allowed to consume cannabis anywhere that it's legal to consume tobacco. So obviously there's some places you can't smoke in parks, you can't smoke indoors, but anywhere you would normally see a tobacco smoker or a little smoking station, whatever, you're allowed to consume cannabis. So it's a lot more socially acceptable. I don't have to worry about, going and hiding or getting harassed by cops.
Or breaking a felony in Washington State.
And, the biggest issue is in Washington is, Washington has a early law that passed. They've been passing slow fixer bills since then, but a lot of the other states have passed laws since the original 502 bill in Washington and 64 in Colorado that have allowed for some of the states to jump over in progressiveness of what we're seeing in Colorado, Washington, etc. So it's something that Washington probably has one of the better markets for developing a brand, but it absolutely decimated patient supply. Mm-hmm. And that's a unfortunate side effect where you see a couple improvements to the industry and then a couple, unfortunate, steps backward in time. But hopefully as industry evolves, we can take a step forward again, improve patient quality even further, and then, not only the cannabis companies, but potentially the producers in Washington can start providing patients direct medicine or cultivating cannabis for them or developing products for them. And a lot of that research, we tried to do it at universities in the states, since they're regulated on a federal level. We're waiting until federal law changes. And while we've raised billions of dollars here in Canada to invest into this industry, we cannot take those same companies public down in the States. So we're actually taking American companies public in Canada.
Brilliant.
It's legal to do so.
So you've done everything from cannabis extraction to hemp fiber with universities in the U.S. to hemp isolate hearts or hemp heart isolates. You've done a lot, and the industry hasn't changed much in the last 5 years, right? And so,
just bigger acres.
Just knowing how much has changed, what's your crystal ball prediction for the future? You moved out of the country in order to move faster. Things move fast already. What does Mike West crystal ball say that the future holds?
So I'm ever the optimist, but also a realist. And if you look at the way that Canada legalized cannabis, they started with a federal medical marijuana program. And then after the federal medical marijuana program was able to prove that we could license consumers or businesses and successfully without the harms, etc., they passed federal legalization. Now there's a couple bills in going around the U.S. on a federal level to open up state-level banking. But I think the first thing we'll see is some sort of federal law that recognizes some form of medical cannabis. I think that's going to take the form of a Schedule 3 or 4 CBD, and then some other form of the other cannabinoids are lower scheduled, but you still have to have some sort of prescription on a federal level. But it'll still leave a local option for states to pass legalization.
So to clarify, with hemp being not descheduled but removed from the Controlled Substances Act, are the derivatives of hemp also?
Yeah. So technically, CBD, if you make a medical claim, is a medical product. If you don't make a medical claim, it's an essential oil.
And that was Curaleaf, I believe, in California that were making claims. FDA stepped in, and then the shitstorm ensued.
If you're going to make a medical claim, you have to be able to provide not only antidotal, but the FDA, the Food and Drug Administration, has rules regulating food and drugs and cosmetics, the Food and Drug and Cosmetics Act, and it kind of goes into the whole effect. Say if you're going to make these claims, you have to be able to prove this, and it usually goes through. First we're going to test it on cell lines, then animals, and then humans. After we have this body of evidence that yes, it is treating these symptoms but we've also identified the potential side effects, then you can approve it and make those claims. The issue that we're seeing where there may be less regulated products entering the market causing harm is because those products entering the market are not being regulated, and we're not doing product safety trials. Those product safety trials should be federally allowed and honestly mandated by the federal government. So as long as the U.S. government is prohibiting cannabis, they are endangering the lives of their own citizens.
Boom. All right, Mike. So for those that want to throw some money at you, looking to have you help them go public, how can they reach you at Mike West with Embark?
Yeah, so obviously my email is mikewest@embarkhealthinc.com, but you can reach Embark at embarkhealth.com. We're going to be rolling out products into the market here in 2019 in Canada, starting Q4 and then all through the year next year, obviously starting with traditional hashes. So obviously best way to try Embark product, come visit Canada, come to any of the provinces up here. We'll be distributing throughout the country in recreational stores. Try hazel joints, and then as we start rolling out the hemp products, they're going to be available in all the grocery stores. We obviously are trying to just set that up fully, but we'll be distributed pretty much everywhere Manitoba Harvest and all the other products are sold.
Oh, so look for Embark. That's EMBARK.
Yep.
Mike West. This is the Talking Hedge. I'm Josh Kincaid. Don't forget to like, share, and subscribe, or don't. And I'm out.